They are some of our most vulnerable, people who rely on strangers to care for them. But some elderly men and women have died. They've gone blind. They've lingered in diabetic comas because nursing home staff failed to give them the right medication.
7 Action News investigator Russ Jones has uncovered scores of cases where nursing home patients are getting the wrong medications, and the consequences are dire.
Roy Rack was supposed to spend just a few days at St. Joseph's Caretel Inn. In the winter of 2011, the 81-year-old had gotten out of the hospital after being treated for an abnormal heartbeat. He was sent to Caretel to get his strength back.
He was alert and happy when he went in there.
And how did he leave?
He left on a stretcher in a diabetic coma.
Karen Rack remembers standing over her father's hospital bed, hoping he'd wake up. But at Caretel, she says his diabetes had gone untreated.
We didn't know, if he was going to make it or not, so, we were hoping we'd be able to get a chance to talk to him again.
You didn't?
No.
Roy died just a few days after Thanksgiving. His family says the hospital helped save his life, but his nursing home ended it.
If what happened here happened in a child care setting, they'd arrest the people involved.
Attorney Jules Olsman has spent more than 25 years exposing nursing home neglect. This, he says, is one of the latest examples. The 81-year-old's glucose level was a normal 118 when he came to Caretel, but by the time he left, only 5 days later, it was nearly 6 times that. His family, who's preparing a lawsuit against the company, said even though staff was told Rack was diabetic, his blood sugar went untreated until his 5th day at Caretel.
It'd be like a fire truck pulling up in front of a burning building, stopping and looking at it and keep going. Same thing.
Caretel officials declined comment on this case, but said they're committed to high-quality care.
Lack of physician involvement, lack of adequate staff, lack of training. That's why you have consequences like this. And this is not an isolated case.
In Michigan nursing homes, significant medication errors are all too common, where patients get too much, not enough, or the wrong medicine altogether. Since 2010, federal records show nearly 150 significant medication errors have been detected here in Michigan. Mistakes that are often blamed on nurse confusion, transcription errors, or simple forgetfulness. At Warren's Autumn Woods Healthcare, a patient wasn't given necessary eye drops for 4 days, then went blind in her left eye. A resident at Livonia's Autumnwood facility was given penicillin even though staff was told the patient was allergic. Brighton's Caretel Inn was home to Emmeline Falls. A nurse gave her 10 milligrams of the diabetes medication Glyburide. Problem is, it was her roommate's. Emmeline went into hypoglycemic brain failure and died. And at the Clarkston Specialty Healthcare Center, an 85-year-old resident went into septic shock after nurses failed to give her prescribed antibiotics. She developed a severe urinary tract infection and later died.
There's no way, reasonably, that a nurse or a doctor or anybody in that nursing home should have been missing that medications, those 2 medications. That should have been given.
It is important, very important to us that our residents receive the ultimate in care.
Gail Clarkson heads up compliance for Metalodge nursing homes, whose 15 Michigan facilities have garnered scores of awards. But over the last 3 years, they've also been cited 10 times for significant medication errors. At its Milford facility, the nursing director said it was a mistake when an 86-year-old didn't get her vital heart medication. In Rochester Hills, Metalodge was cited for giving a patient someone else's powerful narcotics, even after he complained, "I got the wrong medication." The nurse didn't listen, according to the patient, who added, "She blew me off and said the doctor had changed my medication orders."
I mean, these are not small errors. These are, in some cases, critical medications that these patients need to survive.
Any error concerns me. Any error concerns me.
And at the company's Taylor facility, a 68-year-old woman went 8 days without receiving any of the 11 medications her doctor prescribed for her heart condition and diabetes. But Metalodge officials didn't catch it. No, the woman's daughter did.
Well, her daughter would notice. I mean, she knows her mom better than anyone else.
Shouldn't the facility be monitoring this more closely than her daughter, though?
The facility certainly should be monitoring to make sure they don't have medication errors. But
Clarkson insists these errors aren't caused by understaffing or a lack of training. Rather, she says, some mistakes just can't be avoided.
For those thinking about putting a loved one in a nursing home or in a place like this, what sort of assurance can you offer them that that won't happen in their case?
Personally, I can't offer them the assurance. I've been a nurse since 1968, and unfortunately, medication errors occur in hospitals, in clinics, in home health, and people give themselves the wrong medication.
It's not okay to say, well, people make mistakes, that's the way it is. When it's your mother or your father, that is not an acceptable excuse for abominable medical care.
Except for Metalodge, the other nursing homes mentioned in our report declined to appear on camera or did not return our calls. The list of all the Michigan facilities who've been cited for significant medication errors is on our website right now at WXYZ.com. I'm Ross Jones, 7 Action News.
Definitely good information to check out.
Absolutely. You have to check and check. And you know what? Patients always need an advocate
Yep.
listening, watching, and complaining if necessary.
Ask questions. Always ask questions.
Absolutely.